Hi, it's Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor, and this video is called Follow the Physiology. And basically what I'm teaching you with this video is these 3 steps need to be addressed for every single person who has a chronic illness, whether it's chronic pain, asthma, depression, hormonal stuff. If you've had a symptom for more than 3 months, you got to look at these 3 things. Now this is a big picture right here. So for most of my career, I've been looking at somebody's body like, okay, what organ needs support? So maybe it's the liver. So I give them liver supplements and I detox the liver. Now this is for the whole body, okay? And then when I help somebody with their liver, now it's their thyroid, now it's their spleen, now it's their adrenals, now it's their intestines. Well, if you do these 3 things, you're treating the whole body all at once. And all 3 need to be addressed. So the first one is unburden the lactic acidosis. So get the lactic acidosis out of the body. And ketosis helps with that, and there's supplements that reduce the waste products in the blood, and there's supplements that raise the oxygen in the blood. And I got videos on lactic acidosis. I'm not going to get into more details on that. Number 2 is treat the clinical picture. What that means is the symptoms, like why does somebody have their eyebrows falling out and their face is puffed out? It's because their thyroid needs help. So as we're fixing the lactic acidosis, now we're supplying thyroid nutrition, some iodine, some glandulars, some homeopathics, whatever it takes to get their thyroid back in shape to a certain degree so they feel better. That's the point of these 2 things, is you're starting to feel better and you're actually getting better. But if you don't do number 3, you'll never get better, and that's treating the cause. So mold, metals, and hidden infections, those are the 3 most common causes of why the body's not able to heal. The body should just be able to heal on its own. So now, just to let you know, I don't treat infections. That's not my license. But I supply nutrition for the body so that it can take care of the infections on its own. Okay, but you may have some hidden bugs, if you will, in your sinuses, in your intestines, in your lungs, causing sinus problems, causing digestive problems, causing asthma. Okay, so, and these things love metals. And mold loves metals. So detoxing metals and chemicals is very important. Okay, so this is how you really get somebody better. And now you can do this, and the lactic acidosis may go away on its own. But this is what's causing a lot of harm at the very onset of the patient seeking out health care. Okay, so these are the 3 things. Now, these were written down by Dr. Otto Warburg, the father of physiology, and Dr. Henry Harrower, the father of endocrinology, back in the 1930s and the 1940s. Now, I don't know if they talked with each other, but that's where I got this from. These are the 2 godfathers of major medical systems. And as I created these 3 PowerPoints in the last 3 weeks, reading all this old material, it's like, wait a minute, this is what every doctor needs to do. Any healthcare practitioner needs to follow the physiology. Here's the physiology. You got lactic acidosis, you got especially endocrine organs that aren't working very well, then you have some sort of factor that prevents healing. And if you do one of these, you may feel better for a short period of time. So you got to do all 3. Okay, so follow the physiology. FTP, remember that. I'm going to talk about that more later. All right, if you like this information, please give me a thumbs up. Thanks.